In 2005, I was living in the disease of addiction. I was drunk 24 hours a day for days at a time. And in 2006, when I started to try to get sober, I did so in part by attending a meeting in the basement of DePaul. It was in that meeting, listening to DePaul's patients, hearing their stories, and experiencing their strength and hope and community that I found what I needed to start my own journey of recovery.
In this country, every year, 20 million people are affected with substance use addiction. 74% have an alcohol addiction. The balance have an illicit drug addiction and/or an addiction for both substances.
We see the addiction crisis playing out on our streets on a daily basis in Portland today. What we know is that we don't have enough treatment beds for the people who need it most.
If we don't do something about that crisis, if we don't do something about the opioid and the underlying substance use disorder and provide those services and resources for it, we're never going to improve the health of the community.
DePaul is uniquely suited to play a leadership role in addressing the addiction crisis. First of all, they serve some of our most vulnerable community members. Second, they are conveners. Third, they are very trusted. Fourth, they have good leadership that is embedded in the community dialogue. I can't imagine how we'd be tackling this problem without DePaul.
DePaul's mission is to create freedom from addiction, and we have been doing that for over 45 years.
DePaul provides first-class accredited drug and alcohol treatment to more than 2,000 Oregonians every year. And DePaul is committed to providing that care to the most vulnerable members of our community.
Through the services that DePaul provides in residential outpatient treatment and services for SUD, we've been able to coordinate the care for hundreds of patients.
We have treatment outcomes that exceed national averages. What that means is that when you come to be a patient at DePaul, you're receiving excellent care. We have a great team that really understands how to help someone get into the space of recovery, that it's very hard work and they know how best to journey with them.
A lot of us working here are in recovery. Many of us have graduated from DePaul, and so we're able to come back and understand exactly what our clients are going through when they come through the door.
We are a one-stop shop, if you will, that we are able to offer any level of care that is needed, and in a team that works very closely together and literally just has to walk down the hall in order to coordinate care.
I had an addictions counselor that I worked with one-on-one. I also had a small process group that met 2 to 3 times a week with a small group of women, where in that group we shared our traumas, our kids, our families, things that we had lost in our addiction, and we became really close in an intimate setting in those groups.
We really take a lot of pride in being able to reflect back to people that they have, through recovery, they have recreated a sense of their whole person, and being able to walk out of treatment with a higher level of self-respect and dignity and hopefulness about their future.
I see DePaul continuing to do what it does so well, which is working with our most vulnerable people, helping people get sober and get a foot up on their future, and helping people imagine what it's going to be like to have a full life living independently in our community. And so that's my dream for DePaul.
When I arrived to DePaul, I was completely hopeless. I had lost my kids, my family, nearly my life at that point. I didn't want to live any longer. DePaul was able to wrap me up and give me everything that I needed to get my life back. This program saved my life and my family, and I wouldn't be here without this program.